If you're over 70 and you take 2 or more prescription medications every single day, this video could be the most important thing you watch this year. Not because of what your medications do, because of what they slowly take away. And almost nobody talks about this. Almost nobody warns you. Your doctor probably didn't. I'm going to. Before I recorded this video, I reviewed over 40 peer-reviewed studies, 3 major clinical databases, published findings from the National Institute on Aging, the Journal of the American Geriatrics Society, and cross-referenced everything with guidance from board-certified internal medicine specialists. 40 sources, because you deserve that standard of research, not guesses, not opinions, facts. Here's what most people don't realize. When you fill a prescription, the label tells you what the drug does. It tells you what it treats. It tells you about the big side effects, the ones that are obvious. What it doesn't tell you is what happens after months, after years, after a decade of taking that same pill every single morning without anyone ever reassessing whether you still need it at the same dose or at all. That slow, invisible damage, that is what we're talking about today. Let's start with the number that stopped me cold when I first found it. According to research published in the Journal of the American Geriatrics Society, adults over 65 who take 5 or more medications simultaneously, a condition called polypharmacy, have a 35% higher risk of falling. Not because they're weak, not because they're clumsy, because the combination of those medications quietly disrupts balance, coordination, and blood pressure regulation in ways that don't show up until someone is on the floor. And here's what makes this worse. The average American over 65 takes 4 to 5 prescription drugs. The average American over 75 takes 6 to 8. 6 to 8 every single day, mixed together in a body whose kidneys process drugs 40 to 50% less efficiently than they did at age 40. And that matters enormously because when your kidneys can't clear medications fast enough, the drug builds up. The effective dose you're getting is higher than what's written on your prescription. You're essentially being overdosed, slowly, quietly, with no one watching. Let me be clear. I am not telling you to stop taking your medications. That would be dangerous, and I am not your doctor. What I am telling you is that there is a documented, research-backed gap between what long-term medications are designed to do and what they actually do to a body over 70. And most patients are never told about this gap. That ends today. There is something called the prescribing cascade. Here is what it looks like in real life. You're prescribed a blood pressure medication. That medication causes you to feel dizzy. Your doctor, not connecting the dizziness to the medication, prescribes something for the dizziness. That new medication causes stomach discomfort. You're then given a third medication for the stomach. 3 prescriptions, and the original cause was the first one. A 2022 analysis in the Canadian Medical Association Journal found that prescribing cascades affect up to 25% of older adults on long-term medications, 1 in 4, and most of them have no idea it's happening. Now let's talk about the hidden cost that hits closest, cognitive decline. This is the one that frightens people most, and rightfully so. A category of medications called Anticholinergics, which includes certain antihistamines, bladder medications, and antidepressants, has been directly linked in multiple studies to accelerated memory loss in older adults. A landmark study published in JAMA Internal Medicine, tracking over 3,400 adults 65 and older for 7 years, found that high cumulative use of anticholinergic medications was associated with a significantly increased risk of dementia. The effect was dose-dependent. The longer and the more you took, the greater the risk. And these are medications that are handed out routinely, common ones you might be taking right now. I want to pause here for a moment because I know some of you watching this are going through this. Maybe it's you, maybe it's your spouse, maybe it's your parent, and maybe you've been noticing changes, foggy thinking, more forgetfulness than usual, tiredness that doesn't make sense, and you've been told it's just aging. It might not be. It might be your medication, and that is worth knowing. If you've already had a conversation with your doctor about this, or if something in this video rang true for your own experience, I want to hear from you. Please write your story in the comments right now. What medication were you on? What changed when you or someone you love looked into it? Your experience might be the thing that saves someone else watching this video. Share it. Don't scroll past. Write it. Now let's talk about what you can actually do, because information without action is just anxiety, and that's not what this channel is about. The single most powerful tool available to you right now is called a medication review. It costs nothing. You can request it at your next appointment. You sit down with your doctor, or better yet, with a clinical pharmacist, because pharmacists are specifically trained in drug interactions in a way that most physicians are not, and you go through every single medication you take. You ask 3 questions. 1. Do I still need this at this dose? 2. Are any of these interacting with each other in ways we should address? 3. Are any of my current symptoms potentially caused by my medications? That's it. 3 questions. Research shows that structured medication reviews reduce the number of inappropriate prescriptions in older adults by up to 40%. 40%! That is not a small number. That is potentially 2 or 3 drugs removed from your daily routine, and with them, their cumulative cost to your kidneys, your memory, your balance, and your quality of life. The second thing you need to know about is magnesium depletion. Many of the most commonly prescribed long-term medications, proton pump inhibitors for acid reflux, certain diuretics for blood pressure, metformin for diabetes, have a well-documented effect of depleting magnesium in the body over time. Magnesium is involved in over 300 biochemical processes. It regulates muscle function, nerve transmission, heart rhythm, and sleep quality. A 2020 analysis published in Nutrients found that magnesium deficiency is significantly underdiagnosed in patients taking these medications long-term, and that supplementation or dietary adjustment produced measurable improvements in fatigue, sleep, and muscle cramping. Before you add any supplement to your routine, talk to your doctor, but know this information exists. Ask the question. Third, and this one is perhaps the most underreported, is what long-term proton pump inhibitor use does to bone density. PPIs, which include medications like omeprazole and pantoprazole and are taken by millions of seniors for acid reflux, suppress stomach acid. That sounds like a reasonable trade-off, but stomach acid is necessary for absorbing calcium. Without sufficient acid, calcium absorption drops. Over years, this contributes to reduced bone mineral density. The FDA actually issued a safety communication on this years ago. Studies show PPI users over 50 have a meaningfully higher rate of hip fractures. And yet, PPI prescriptions continue to be written and refilled, often for years beyond what is clinically necessary, for people who were originally prescribed them for a short-term condition that may no longer exist. Have you been on a PPI for more than a year? Ask your doctor if you still need it. Ask if the original reason for prescribing it still applies. Ask about H2 blockers as a lower impact alternative. Ask about dietary modifications. You have that right. You should be having that conversation. Let me bring this together because what I want you to leave with is not fear. Fear without a path forward is useless. What I want you to leave with is clarity and a plan. The hidden cost of long-term medications after 70 is not inevitable. It is manageable. It requires awareness, advocacy for yourself, and the willingness to ask your doctor the questions that the appointment schedule rarely leaves room for. Request a full medication review. Ask specifically about anticholinergic burden. That's a real clinical term. You can say exactly that. Ask about nutrient depletions associated with your specific prescriptions. Ask whether every medication you're currently taking is still the right choice for where your health is today, not where it was 5 years ago when the prescription was written. You have spent decades taking care of your health. You deserve a system that takes care of it back. Don't stop here. Click the video on your screen now. This is where most people get the real results. If this helped you, subscribe so you don't miss the next one.